Hi, my name is Robert Roswell. I am on the board of directors of the ABIM, and I'd like to welcome you to the Foundation Forum. I am the Associate Dean for Diversity, Equity, and Inclusion at the Zucker School of Medicine at Hofstra Northwell, which is located in the New York City metropolitan area. As you know, COVID has really had a tremendous impact on the New York City metropolitan area and on our country. New York City was the epicenter of the outbreak at the beginning, and Northwell Health was the epicenter of the epicenter as we took care of a lot of COVID positive patients. The pandemic has really unmasked a lot of healthcare disparities as it relates to racial and ethnic minority populations, also to our socially vulnerable populations. And as we have this forum that builds trust in health equity, I think it's critically important that we understand the mechanisms that undergird mistrust in health inequities as they relate to race in our country. And the foundation of race-based health inequities is structural racism. And it actually is into all policies and a lot of structures in our society, and also into healthcare that really further and propagate race-based inequities. I think if we begin to build trust in health equity, we have to understand structural racism. We have to identify it. We then have to talk about how we would address it. And so the first step is really to address it, but other steps include building empathy and action towards racism, structural racism. And VR, virtual reality, is a tool that we've been using in the academic medical sphere. So what we're accustomed to seeing in academic medicine are virtual reality situations like this, where we have a respiratory therapist, sort of, and a pharmacy technician. We have an intubation tray. We have physicians there in a pediatric emergency who's wearing an Oculus headset and trying to administer care to a patient. You know, you could actually interact with the VR, check pulses, check breath, and this is a simulation that can be done in person, but you can also use virtual reality to simulate these high intent situations that don't occur as frequently. So where we see VR headed is the Oculus headset, and where we can do a 360 video where you can participate, you can sit down in a restaurant, you can be simulated like what's depicted here, seen driving and traveling while black in the back of a bus. And VR can transport you to a certain situation where you can sit at a table and experience a conversation with Tamir Rice's mom after he was killed by police, and just sit and absorb what had happened as if you are a participant right there at the table. What we've done at the School of Medicine is actually, we started a VR project where we've exposed faculty, staff to discrimination, where we transported them to be a Black child, a Black man, a Black adolescent, and experienced racism and discrimination from that person's perspective, which was the faculty member. And we see that that is a mechanism to actually build racial empathy, that people could understand what it is like to be discriminated against and to feel bias and structural racism virtually. So in this workshop, we'll work towards building a new VR experience to earn trust with our patients and to build towards health equity by building VR scenarios around microaggressions, bias, and anything that we think of that will build inclusion in the medical school atmosphere in our health institutions. Thank you, and I hope you join.